You
guys may have to unmute again.
No, I'm unmute already.
Okay, good.
Can you hear me?
Yes.
Okay.
I think I'm still recording.
Okay. You're recording? Okay.
I thought so. Yeah, it is recording.
Yeah.
Ravi, you may have to unmute.
Yeah, so I think Srini, you want to do the introduction?
Yeah, I will. If anybody is joining, I can go ahead.
Can somebody monitor the people queue? So if someone is trying to join, can let them in.
We don't have filters, so it's automatically they can join.
Okay,
Okay.
good.
Okay.
Okay. Go ahead,
Laxmi,
Srini.
can you hear us? Dr. Laxmi, can you hear us? Doctor? Dr. Laxmi, madam.
Hello, can you hear me, sir?
Yeah, I can hear you, doctor.
Yeah.
How are you?
Yeah. I am good, and
Okay.
I'm so sorry.
That's okay. I will take some introduction
yeah,
and
I'm
then you can go ahead
very
with the
remote.
present. Yeah.
Okay, go ahead, Srini.
Yeah. First of all, thank you, Dr. Laxmi, for joining to cover this topic. It's my great honor to introduce Dr. Laxmi Lakade, a pediatric dentist who beautifully blends science and creativity. Beyond her practice, she is an avid nature lover and an artist, and also enthusiastic traveler. During the COVID-19 slowdown, her journey deepened through meditation and formal training in the spiritual tablet course, where she later served as a spiritual counselor. Dr. Lakade believes that science and spirituality are two ends of the same tunnel, and that we are all the conscious creators of our own lives. Today, she is here to share her wisdom and inspire us to become our best self. Please join me in warmly welcoming Dr. Laxmi Lakade. Without further delay, I now hand over to Dr. Laxmi Lakade. Please go ahead, ma'am. Stage is yours. Thank you.
Yeah. Thank you for all these kind words. And I'm so glad to know the forum like this conducting such topics for alumnus. Holding, if I'm not mistaken, the two extreme ends of alumnus, wherein you have the youngest one and the most eldest one here. I realize we each other to make best of our own lives. Yeah, that is how I understand this platform, helping each other. Thank you for this opportunity, and I wish to show my gratitude to most of people who have made me in whatever little and big way, and that's where I'm here to share, not just by reading the medical content, but lot more than that. And if we connect the gap, which was probably myself, not know more about myself, and that's where I that um, it's gap between the science and spirituality, because of which we sometimes have this problem of health or disease. I would rather say that way. And going forward with these slides, I would wish to share Ravi sir, to move on to the next slide. Yeah, when we say health, we always think health is somewhere out. And when we think disease, we always think it is inside. And we keep on struggling between, achieve health. Thing which today we want to sail through this topic. Next slide, please, sir. Next slide. and you need thank you. Bear with us. Next. Yeah. So today I wish to take you all to the little, known more than me, and certain aspects. I mean, as a though I'm a pediatric dentist, but I'm sure lot more has been imbibed more than the teeth, which I would have rather read and learned, because most of the content what we learn is definitely the medical sciences, and that is where I feel, and I come from a bunch of doctors family, and I felt we and the medical understanding, that's where the hint wherein I always felt that I can learn more and know more about our own self. So I wish to take you all through what are the different layers of your body, and how or what you mean by health and disease, then what exactly affects your health, and how we manifest disease, and what is the role, or the what are the factors which influence our health and disease, the core things which we otherwise think that disease is caused due to this and health is caused due to this, those aspects, and definitely bringing little bit of more of medical science uh, to make it more firm onto other aspects, actually, whether it is really, I mean, we keep on hearing that today about lot of things, that lot of lifestyle diseases are because of tree. So, and then definitely and help in integration of this all knowledge, and sharing or making that knowledge to wisdom. That's a practice in between which is needed. And I would like to share my journey through this. Yeah, next slide, sir. Yeah, next slide. So we always tend to see, I mean, this platform, I'm sure it is more of ingenious, but then even science always reflects your physical body. Okay, so the most understanding goes in maintaining this physical body, but if you see, it is just an outermost part of us, that is your physical body. Then the next layer, the inner one, is the energy body, then it is mind body, then it is your wisdom or intellect body, and the bliss body. So today I want to slightly talk about these aspects. I'm sure most of us might be understanding with the words which are self-explanatory here. So next slide, sir. Let us understand how these physical body, or how this bodies are made up of. Okay, so if I say physical body, I know, I understand what I see myself as physically when I see is all the parts of our body. And how am I made up? I mean, how strong or how weak I am, it all depends on what I eat, how I eat, what type of food I relish, right? That is how my physical body is made up of. Then the next one, my energy body, which nothing, which is dependent, or would say energy body affected by
Ma'am, can I interrupt you for a second?
Yes,
Sorry to interrupt. Maybe your bandwidth
yes.
is low, so you can turn off your video, so at least the voice comes through nicely.
Yeah, I did that.
Okay, wonderful. Thank you.
Yeah.
So,
Now,
go
is
ahead.
it
Very
fine,
good.
sir?
Yes, it is good. Yep.
Yeah. So the next one is the which we gain most of insight of our energy body, or our most of our energy body is gaining its input, I would rather say, by our actions. That is your mouth, your hand, and anus and genitals and the feet. Now, why I'm stressing on this is a few seconds later, I will let you know. And what we experience is all the senses, that is your hot, cold, hunger, thirst. Yeah. And then the next layer is body, your mind body, which is again the input here is nourish and is eyes, ears, nose, tongue, skin. And here we experience like either your feelings or the emotions, what we say, like it could be anger, it could be frustration. Yeah. And here it is your mind which is coming into role, that is your subconscious mind or your um, uh, conscious mind. This is where the belonging happens from this mind, is your subconscious and conscious mind. And then the next layer is the wisdom body, which means it is gaining its input from the knowledge we are gathering either from our parent or from the reading and learning through our childhood, the society influence of so many aspects nowadays, the content which we draw from so many input, social media, so many things. And we have this power of analyzing and discrimination, generalization. All these come and belong to this body, that is your wisdom body. And then the last is your bliss body, which is hardly we are training it or hardly it is given attention, be it from birth till, I mean, not later till we age, we say that, oh, now I need to look into myself. So this body is hardly, taken care of. Okay. So now with the 1 minute, like a pause here, I wish you all, if you could take a minute and say that what part of your body is affected or what part of your body is troubling. If you can take a pen and a paper, it would be great. If not, if you have your any soft gadget there, you could just pen down. I want you all to do that because it's a hint how we actually scan ourselves. It is very much possible that we know how we are dealing our own issues, and little bit of awareness if we give. I wish you all to just look onto this part and just what are the parts of your body being affected. Yeah, Ravi sir, I think so people can do that for a minute, and I'll pause here for another 30 seconds. They can just write which part of their body is troubled. I mean, if it is the youngsters, or I'm sure there would be something at what level they are being troubled. There is not just the physical body, there are many other. I mean, are you carrying some anger, guilt, or all those things? You can still categorize them into which part belongs.
Yeah, sure, ma'am. Definitely. We'll take a brief pause.
Yeah, yeah, yeah. And it's good to do that.
Okay, sure. So I can go ahead, ma'am. So for me, I think it's
Yeah,
at the
yeah,
moment, I would say it's a physical body,
yeah,
mostly related to the, I think
yeah.
the experience I got during the COVID. And, most of us in the IT world working on the computer for almost 8 to 10 hours straight out, and you have a different
Mm-hmm,
posture, and those
mm-hmm,
things is going to cause certain nerves to work more harder than the others. I think for me, the neck and shoulder pain is the one I'm dealing for quite some time. So I think that's I would maybe it is
mm-hmm.
more of a physical, not necessarily the sensual organs on the body, or the anger and other kind of stuff. So for me, on the physical side at the moment.
So that's good, sir. Yeah, yeah. So
And
we take this as one sample and we place it as a physical body. Okay.
right.
Yes, sir.
Anyone else want to share anything
Yeah.
from your point of view?
Yeah.
Please unmute yourself and go ahead and share.
For me, always brain, I always think something, always. Even today, I'm thinking. So
Yeah.
that is one thing I take because I have some assignment coming up next week. I'm already planning that. So even though when I'm silent, I will always have some thought going on, right? So that is one. And then like Ravi said, body.
So-
See, heart rate, breathing, these are all common things, right? Like they all, when you are silent and when you are talking, almost these things will always, work impact also, right? So yeah, that's where mostly I noticed.
Yeah.
Anyone else
The
want to
main,
share?
yeah, the
We'll
main
put
thing I
it
see,
in,
yeah, the main thing I see in life is mainly if
I think so
I
that
had
we
this,
will put into
I
I
see the
think
one
Swami,
thing,
right?
mind
Swami,
Go
body.
ahead.
Swami,
Okay.
yeah,
The
Swami,
prior
yeah,
one.
Yeah, one
yeah,
more. We have one
yeah.
more.
So the main thing I see in life is we all know what needs to be done, and I try to do that, but I have a problem with consistency. Whether it is psychological health, physical health, work, professional life, or taking care of kids' education anywhere, having the consistency is where I have a problem.
Yeah. So that means, Swami,
Yeah.
correct me, you are thinking more brain also you are using and heart also like almost breathing, right? When you start thinking.
No, I do physical activities. I do run marathons.
Yeah,
I
I know,
keep
I
my
know.
Vivo to max, everything
Right.
do. But I don't keep it like consistent. I do run like 6 months. Then, okay, I want to start at 7th month. I can't do it at 7th month. Okay, I want to do wake up at 6. I wake up
Right,
at
right.
7. Anything I want to do, I will slip. That's what I'm trying to say.
Yeah. So great, sir. So we put it in the mind view. Okay. A few examples and share by use. Each one of us, we realize that always this, though I say there is a sample which is saying that it is physical body, but my energy body is also affected. Okay. So when I say the mind body is affected, then that means even the wisdom body is affected. So there is always an overlap. And whenever the wisdom body is affected, definitely when the diseases come, that means all the layers are affected. For example, if I say I'm troubled in my neck, that means my energy body is affected, my mind body is affected, and my wisdom body is affected. We will not go to bliss body. We will just wait for that for a little bit more longer. So just if I evaluate these four, then if I say I'm having pain in my body, that means my energy is blocked at even the energy body level, mind body level, and wisdom body level. Okay, this is what we have to understand. When the physically we are affected, that means my all other inner layers are definitely affected. It is only then the disease is manifested. Okay, next slide, sir. So now we all know that WHO is the biggest organization to, give certain aspects. And here I've just for a sample taken that to understand general and what health means is definitely we all understand the physical health, mental health, but if you see the third component is even the social well-being. Now when they say social well-being, that is because there are a lot of diseases which are behavioral or disabilities which are tissue, where they say of disease. Okay, it is not just the absence of disease, it is the overall well-being of a human. Okay, overall health. And at the other side, when I saw, for me also it was, surprising that disease is not being defined by WHO. Okay, because I realize maybe it is so vast in nature to put it in few words. So rather to just understand what is disease means, it is just the disorder of a body or a mind. Okay, so it is just the disruption. Okay, next slide, sir. So when I understand it is just the disruption, that means definitely it is just the imbalance which I'm creating in my health. The disease is nothing but we are not ease with our body or our mind. So that's where we have the understanding. Next slide, sir. Next slide, sir. Yeah. Yeah, it's gone. One slide before, sir. Just before this. Yeah. When I say that the physical body, that means either the problem lies with the kind of food I eat. Okay. If it is animal based diet, definitely by my body is never made up, my digestive system is never made up for that. My digestive system, that is human digestive system, is only supported for a plant based diet. If I am having a animal based diet, that means I am abusing my digestive system. So I'm creating the imbalance by either the what kind of food I'm eating, how I'm eating, quantity, quality, and am I really with my mindful eating? And if not, the balance will be manifested as the illness, the fatigue, the obesity, the lethargy as a physical manifestation. Now, going to the energy body, if I say my imbalance is created because what I feel within myself, okay, what I feel is due to my energy. We have to understand, you all are, I mean, science background with a lot of physics, and Einstein did say that we can have our energy which will be in the same, it can transform one from one form to another form, but we can neither create or destroy the energy. So whole my body, human body, is nothing but a form of energy which is manifested as a matter. So however, if my energy body is not, you know, well maintained, my energy is low, then I am manifesting the any kind of disease which is relating to my stress, anxiety, my sleeplessness, emotional turmoils. Okay, that is how the energy body will be manifested. And then the mind body, wherein you have lot of uncontrolled emotions or trauma, or which are more related to your subconscious, and those are the kind of emotional imbalance which we can see with the mind body, which will be manifested in those aspects. Me can be psychological distress, right? And then the wisdom body, wherein you have the intellect, that means there is no right kind of knowledge to make the difference between the judgment of in a given situation, all the time being confused because of many other imbalances which are there. So it could manifest like a dissatisfaction or emotional imbalance. Yeah. Next slide, sir. So that means, just to concise with all this, I would rather say the physical body and the energy body, these are nothing but as one component. The mind body and wisdom body as one component, because that will help us to understand we are nothing but made up of the energy body, right? And the wisdom body, that is the mind and wisdom body, and the conscious body, that is your bliss body. So I would rather say ECW. I'm made up of E, that is energy, C is my consciousness, that is the bliss body, and W, that is nothing but your wisdom body or the mind body together. Yeah. So next slide, sir. So now let me understand. Next slide, sir. How is this happening? So if we go by Darwin's theory, theory wherein we initially believed, okay, a lot which is related to the genetics, okay, that is my most of disease or my problems in my body or my mind or any kind of disease would be related to genetics, okay. And a lot of work did belong to this kind of understanding. Yeah. Next click, sir. Yeah, thank you. So now there is a great revolution. Let us understand that it is not the genetics. There is something above or beyond genetics, which we call it as epigenetics. And here I would like to really bring you all to, to stress on to this point and understand this point, that genes are just a part of your how you are, but how you want to be is what your epigenetics means. So what it means is that it is beyond your genes. Now how do I understand, how do I understand by this that the genes, whenever we are having on our chromosome, it is not that all genes are all the time operating. There is something called as switch on and switch off, like in a very simpler language, which gene has to be on and which time, which gene has to be off which time, is determined by a protein around our body. Okay, in a cell, if I take this as a gene, then it is my cell around the environment of that gene will determine it. Okay, it says, okay, my body now it is, way breathing heavily because I'm running. I'm telling my cell is now telling my, protein in my cell and telling my gene to signal it out and say that my cell, that is all the blood cells, to circulate more faster, absorb more oxygen to meet my body's needs. Okay. So next slide, sir. So if I have to make it in more precise way, the genetics means it is your nature. That means the literal meaning is how your parents look, you're going to look in the look like your father, you look like your mother, you have inherited eyes like your grandma. Yeah, so many things we say. So there are the physical characteristics which we define from the nature, that is genetics, from our parents. And that's where the chromosomal exchange happens between the male and female, and then we derive that from our parents, and we say genetic material is being inherited by the parents to the offspring. Yeah, the next click, sir. However, the nature or the environment is so beautiful, and that's why we all humans are different. We all are genetically made same. That's why we are human species. Wouldn't have been an ape if it is way, way, way less that the genetic material which will determine, which is slight variation, where we say that genetically inherited diseases, only then the manifestation of diseases happen. But otherwise, how I am different from you then? It is my upbringing, the way I am being nutrited, nourished, cared, cultural variation, my own experiences. My experiences are also gained by my parents, my surrounding, my society, my school, my teachers, my peer. Yeah, that all boil down to just saying that the external factors or the environment. So the nurturing will determine what kind of genes my body needs to be on and off. If my nature says, the external factor says, I need to be, feeling good because my atmosphere is good, I will secrete the protein which is making me feel good, and my genetic material always will release that kind of gene on. Okay, that on, or the switch will be on, which will release my hormones which are related to oxytocin, which are happy hormones, which are making me and making me more happier. Okay, next slide, sir. So just to make it more simple, I have just put in here, we can see a mango. A mango seed will always grow and make a mango. It will never make a tomato. However, that is genetics. Okay, that's genetics. Of course, a mango seed will definitely yield into mango, never a tomato. But what is a nurturing? What is epigenetics doing? That means if my in a very good soil, it is taken care by light, then for manure, then pruning, then love and care by the gardener. All this will lead probably into a good mango tree. So there is a huge difference when I say that a mango tree will turn into mango. Definitely, that is my genes, my genetics. But how is it good and how bad is definitely determined by the nature or the nurturing or the environment around the mango tree. And that's that simple, that we humans are also like that. We are all genetically made up by the genes what we are. However, we are more determined by our epigenetics. That means our own environment or our own surroundings we are belonging to, or how we make up our mental mind. So next slide, sir. And that's where I say that genes will determine your eye color, probably hair color, and the blood group. But see from where the disease is coming. It's from your environment. Obesity. Yeah. Next slide, sir. Next slide, sir. Yeah. So it is not the content which I am speaking from my own, but definitely there is a huge experiments done around. And I would like to take at least one person's name here, which deserves a lot of attention. Bruce Lipton, who says that you are the biology of belief. Okay, this is a very good book if you all can really go into more deeper if you wish, wherein the small experiment, what did he do is that he collected stem cells, cells which are very fertile to grow any kind of cell. You name it, it will become. Okay, such type of cells he collected in a dish. Okay, and he gathered some growth factors, he put into that dish, and it grew into much more good cells. So with his background, because he's a doctor, a PhD holder, and a cell biologist. What he expected is that all the cells will grow good and it is renewed. So this is how our body actually renews. Okay, we all are made up of so many, 50 trillion cells. Okay, how is replenished? We have something called as the pluripotent cells, cells which are continuously formed, and they're all same when you to begin. Okay, when we begin, they're all same. It is how my body requires. Okay, my skin is shedding off more than my hair, so my body says that that cell to grow into more of skin cells rather than the hair cells. Okay, so who is determining that what I need? It is my environment, my skin wearing off more faster than my hair, right? So that means my environment is determining my needs, not my genes. Okay. Now, what he continued with this experiment is next slide, sir. So, to his surprise, when the cells he took into the next, dish, what he did is, if the gene theory was true, that means all cells turn cells. But in fact, that didn't happen. Okay. Instead, it turned into skin cell or the muscle cell or the nerve cell or what kind of cell that needed to be. So, which showed what he did is he took the cells which were in the dish, he put into 3 different further dishes, and he changed those growth factors. And he observed, depending on different growth factors, different cell grew. That means in first dish, if he has put growth factor 1, that grew into skin cell. The second dish, he put the growth factor B, it grew into muscle cell. Third growth factor he put, and it grew into nerve cell. And that means it grew into nerve cell, means the same cell, the parent cell, grew into different offspring cells. That means the growth factors were determining the outcome of the cell which will grow. So genes are the supportive structures. However, the environment, that is the growth factor. So for us, the growth factor is from where? One, if I consider my whole body, where is my, my growth factor coming from? It's your brain. It's your brain, which is the chemist of your entire body. And when I say brain, that means it is the mind which is determining the most of your body actions. Now, when I say mind, it is not just the conscious mind. Next slide, sir. So we are made up of our mind, but it is your conscious mind which we all look into. Most of us, as a conscious mind, we are always dealing with this most of the times. However, it is only the 10% of you. If I see this iceberg, only the tip is the 10%, but the entire 90% belongs to your subconscious mind. And that's where, to understand, conscious mind can think, but subconscious mind is a creative. Okay. So it is all about what we see. Logically we think, critically we think. Thinking all ability belongs to your conscious mind. However, the belief system, the core feelings, the emotion, the habits, the personality, the values, the long-term memories, imagination, abstract thinking, all belongs to subconscious mind. Like for example, if I have to explain it with just one example, we all drive, right? We all drive, and suddenly we start thinking, or suddenly, even if we are on call, or even an audio, we're still driving in a right way. What is that happening? So thinking is done or hearing is done by your conscious mind. However, your driving, that is done by your conscious mind. It's gone into autopilot mode. That means it has developed that muscle memory, because that's how the habits are developed. Okay, it is, do we think that today you need to teach me how to brush? No, I will get up, I will get and I will brush my teeth, because that's gone into my muscle memory how to brush and when to brush. But for a child, if you see, we have to remind it, because it is still not gone into the subconscious mind. It's not developed as a habit. It's not gone into his or her subconscious mind. And that's where the development of the habit takes place. The more you practice something, it goes much more deeper and settle downs in the subconscious mind. The things which we usually do understand when we say it is a conscious mind, it is superficial. It's a short memory. Next slide, sir. And now why I need to know all this, why I need to really bring you all to this page to understand that I am not just the body which I can see. I'm more than that. I have different layers, and all those layers are controlled or more controlled by my subconscious mind, because we are right from birth trained to manage our physical body, trained to manage our conscious mind. However, we lack, or we are less pressing body and our subconscious mind. Because when we say belief, when we say positive thinking, when we say negative thinking, when I say my core principles, when I say my habits are good or bad, when I say personality, that all is derived from subconscious mind. And that's where, to just give an example in a way which you all understand much better, if I take a mobile, when I touch, my touch screen belongs to my conscious mind. However, to that or the program there, and that's my subconscious mind. The more powerful programming I have in my mobile, the more the better the screen, the better. Same way, the more the better the programs my subconscious mind is having, better my habits, better my performance, better my consistency. And that's where we say that someone, just now said that I cannot consistently do something. That means it is still not gone into muscle memory. It is not still gone subconscious body. You need to train subconscious mind. You have well trained. We all are well trained for conscious body or conscious, sorry. Yeah. So next slide, sir. And that's where, I really wish to say that the mind's input comes all from the things around us. The conscious mind is very selective. Okay. Something I feel good, I will hear it. But subconscious mind is not like that. It is not selective. It is permeable to most of things. When I say that, that means what we perceive will settle into my conscious mind. But what I practice settles down into my subconscious body. And that's where the, most and basically that is how we are, manifesting our even the health or the disease too. And that's the environment, that's the input, that's the environment which we are seeing that, So now you may ask, program? Yes, we all are programmed. To be very frankly, if only 7 years of our age. The first 7 years of our life, the brain expands, grows. There's absolutely no growth after the 7 years. It is only the synapses. Now, how then we may ask, what is that growing then after that? It is the synapses between the two nerves. There are junctions. It is the connectivity which increases. The multiplication happens in the connectivity of each nerve to other nerve. And how is that happening? The more you perform something, the more wiring of those one nerve to another nerve happens. So something which I practice dance. Okay, I practice dance, then my synapses of those nerves will keep on building up. I practice singing, that gets more. Something which I'll not practice, maybe a drawing, then that synapses will not happen and that reduces and those nerves wear off. So it is then in that case, what happens? Most of our programming happens in childhood. So we say, sometimes when we see a child, we say, oh, you sometimes behave like your mom. Sometimes you say you behave like your father, you sit like your father, you comb like your father. Why is that coming? Where is that coming from? So the first 7 years, the programming, where is the child getting from? It is your parents, your schooling, your neighborhood, your surrounding. Yeah, that is the environment input. The input to this software is coming from the environment, the peer, the sibling. So now you understand. If it is more positive, the more programming is positive. If it is negative, definitely the negative programming and the outcome, as I already said, that the environment is determining my gene, which one to off and which one to close. So now we should be aware. I know we are all made up. Oh, now if I'm fearful, by 40, I'm already programmed by so much of my environment around. Social conditioning, childhood trauma, societal differences, so many ups and downs of life, to which we say good and bad, success and failure, right and wrong, grudge, so many things. You can see now the inputs, where all it is coming, right? So if I say that all 40 years I've imbibed or I have been programmed so much, that means already my software is built up. If it has been more of positive, more positive, more of my mind is positive, more of my body is positive and healthy. More of negative inputs, more of my programming, which is negative, more which is not supporting my body, my mind, more towards the illness, more towards the discomfort, more towards the imbalance. Next slide, sir. And that's where we say that we have been programmed much more earlier, even we realize it. The early programming extensively happens at 7 years. So my question today, why I need to listen to all this, and how can I manage, or can I really change myself? Yeah. So yes, it is quite possible. Your body is so miraculous. It is so miraculous. You will never be able to even understand, no matter how great scientist we may have. Because biology doesn't work like 1 + 1 is equal to 2. It doesn't work like 3 + 5 is 8. It never works like that. It could be 3 + 5 is 100. And that's how the biology is. And that's where a different kind of diseases, different kind of nature we have, different kind of, you will see, in a same family, a very good example could be in a same family, the same culture, same programming, yet they will turn into different personalities. Why is that happening? That means the input is not just from the parents, the input is from so many, environment around that person to develop that kind of personality. But choice is always yours. The choice always remains yours. So can I change my belief? Yeah, of course you can change belief. Now, where do I begin from? It is as simple as to train your subconscious mind. Yeah. Now, how do I change my subconscious mind? I keep on suggesting it. Okay. Next slide, sir. A very good example, just to show what I mean by how can I program? Okay. How can I really program? It's just one very good experiment done by scientist, wherein he just named it as classical conditioning, wherein scientist he showed he took. What he did is that in first picture you can see there, he shows food to the dog. Automatically, the dog will salivate, okay, to the food. I mean, he wants to eat, he will salivate. I mean, saliva will come. I mean, it will start showing the drooling, right? The next picture, what he did is he has a whistle. He just blew a whistle and he observed the mouth of the dog. There was no salivation because the dog didn't relate that anything to that whistle. He didn't relate to it. But how clever he was. What did he do is, next time, what did he do is he blew a whistle and then he gave a food. Now the dog made an association that whenever there is a whistle, there will be a food. Now he's conditioned. So next time when he whistled, the dog started salivating. Okay. So what that means that we can condition our mind. We can train our mind to the outcome what you want. So what he wanted after whistle, he wanted a salivation. How did he train? He associated it with some good reward. That is, after whistle, he conditioned with the good thing. That is a food, which is something which the dog relishes. So he conditioned with his good factor, that is and the end result was that even by a whistle, the dog started salivating. That is how the conditioning happens. That means, can I train my subconscious mind? This is the only theory behind it goes that you condition your conscious mind, or sorry, subconscious mind, so that it can come up with the outcome, desired outcome you want from yourself. Okay. Now, how do I do that? Next slide, sir.
Doctor, just a time check. There's 5 minutes
Yes,
left.
sir.
So I
Yes,
don't want to
yes,
rush
sir.
you, but it's a really
Yes.
good, very good explanation you're giving.
The
But I
last,
yeah.
few more seconds. Yeah. So that means that the imbalance, next slide, sir. That means disease is nothing but the imbalance we are creating for ourselves from our own thoughts, our own speech, our own emotions, our own actions, and ourself. When we have imbalance between what we feel, what we think, and what we say, and what we do, okay? Think, do, feel, and say. When there is a definite difference, we have all these masks. I think something, I say something. I say something, I do something. When there is a imbalance or mask, so many masks I'm having on myself, that means the imbalance which is created. So that is where the disease manifests. That means I'm not ease with all of these layers of my body. My mind body is affected, or my physical body is affected, or my intellect body is affected, some or the other, because of my so many environment factors which we spoke. Next slide, sir. That means so many life disorders are mostly coming from the environment. Take it your diabetes, cancer, take any of those, hypertension, obesity, addiction. So it is all from the environment. Next slide, sir. That means where are my stress, all the stresses? What are those stresses? Maybe my desires, my greed, could be a abusive relationship, could be my workplace, which I'm either over ambitious or I'm more sticking to my failure, could be my isolation, or could be my loneliness or disconnected from the social being around us, or disconnected with myself, not making care of myself. So overall well-being of myself is definitely which we are not taking care. So all my stresses are nothing but which are coming from my environment. Now, how do I deal it with? Next slide, sir. That means, as I said, once again coming back, that I'm made up of energy, consciousness, wisdom. Next slide, sir. The question really comes is here, do I really wish to change? Do I need to change myself? Is what everyone has to ask. Only then there will be a path for ourselves. Next slide, sir. So I don't want to go by things which I'm saying here just by the words here which I've put in, but then I have worked upon them. Okay. So next slide, sir. What do I mean? That when all this knowledge comes, knowledge is what? Knowledge is just the facts. But then how does it turn into wisdom? It is only when you start practicing. When I say surround yourself by positive words, surround yourself by positive people around you. Stop taking any negative inputs. That means you have to connect your body, that is body, when I say physical body and energy body, has to be connected to my mind body or the wisdom body. And how do I see that? How do I see is that training my subconscious mind. And how actually, I mean, because why I wanted is because I suffered from migraine for almost 8 to 10 years. I suffered from seasonal bronchitis for almost 5 years. And how did that happen? That was all from the environment which came. Next slide, sir. And how did I work? Today I'm not on any medication, I'm not on any of those which I needed from outside. It is all within me. So how it happened in COVID times, I hit upon meditation, many content which I could go through, settle through. Almost a 9 months of meditation helped me to, one summer I didn't have any migraine. One October, which is a season change, which I didn't have, cough. And that's a surprise which happened. And what was only change is the meditation. And what more went after that was the journaling. What were my feelings, which were nothing but my lot of emotional, which had been piled up, blocked my energy body, which went out by journaling out. Lot of book reading. That means my intellect body was trained. Something which I effectively try to apply even today is that forgiveness, gratitude, and self-care. And I wish to share what I read. And then I definitely did, spiritual tablets program that was for 4 or 5 months, and which was nothing but a tablet, not a physical tablet what we take, but a tablet which is given as a wisdom. And that session for 4 or 5 months helped me to learn many things about myself. And that's where my bliss body was complete. And that's where I felt asking help through the people or the courses makes you definitely a better changed person. So it is a very important aspect, not just to collect the knowledge, but practice and convert it into wisdom. Next slide, sir.
Can I ask a quick question, Doctor, there? So you mentioned about the bliss body.
Yes, sir.
How long it took for you to get to that state?
Still work in progress.
Still work in progress. Okay, that's a good answer. So
Yeah.
So it's a continuous journey.
Yeah.
So you
Next
keep
slide.
refining yourself.
So that itself is a big topic, sir. But then, yeah, definitely it is. Everyone can taste it.
Okay. Thank you.
It's not a permanent one. It's never permanent for me. It's on and off. That's where we still say that healing is never a linear path. It's an up and down.
And all the
Yeah,
external
next slide,
factors
sir.
are influencing that. Definitely the environment.
Yeah,
And
they're still, yeah. So how you program your subconscious mind is to suggest. Hypnosis, what we say is suggestion to your mind. So the simple technique is that while you're sleeping, you just suggest what you want and do it for at least 41 days. Why we say 41 days? That is the amount of time we see that your subconscious mind gets trained. You want to develop some habit, you tell it to your subconscious mind while going to sleep, and that is the auto suggestion we say. That is nothing but hypnosis, or wherein your mind, your subconscious mind is completely relaxed, and it is suggest you, and it imbibes most of your words. And 41 days are required to develop a new habit, to sustain at least. And these were the few books which I really read through and shared most of these. Biology of Belief and Placebo are the good books to understand at a cell level, micro level. Next slide, sir. Next slide, sir. Yeah. So these were a few books, and these are the few forums wherein I have drawn a lot of content which I felt was good for my mind and body. Buddha CEO Quantum Foundation, which runs freely, absolutely, and a lot of content, which is you all can really go on to this link and see they have continuously free session whole year, absolutely fabulous content and the speakers there. And spiritual tablet course, again, there is a lot of testimony, which have been developed there. And Your Placebo is a book which is case study. It's a different book which says, okay, I have a cancer. You may say, ma'am, you have just healed, migraine. You have just healed bronchitis. What big thing? There are people who have healed cancer. Joe Dispenza is author of that, who has miraculously manifested his spinal cord fracture following, major, accident in just 3 months without surgery. What did he work on? Mind. And there's a lot of testimonies. The entire book, You Are Placebo, entire book comprises of such testimonies. And the word placebo means it is in absence. Okay, patients which are terminally end people, wherein there's no medication going to help, but then we need to give some sort of support. That's where the doctors give, okay, the tablet is not actually tablet which is really going to help them. We just say that, oh, you take this, you'll be very best, it is a new medication and you will come out of. So these words help. The placebo effect, again, it is a huge topic in itself, but then yeah, it works. It definitely works. And that's all I had to share today. Yeah, next slide, sir. Thank you so much for all the time and bearing with me. And this is another, and I'm like very close to my heart. It's a 4 agreement book, but it derives, even if we stick to these 4 principles, it is a biggest challenge if I can do it even in my this lifetime. What is that? Be impeccable in your words. Do not take anything personally. Do not make assumption. Always do your best. This book is amazing. It is just a 40-page book, but a lot says how we are domesticated. We domesticate our pets or our animals, but it is really hard to tell how we are human being domesticated already with so many environmental factors. And this book is drawing a lot of knowledge to make us understand this, these 4 principles. Next slide, sir. And this is one more, just a diagram to show, which draws to tell how do I know myself. The how do I know myself is by this Venn diagram, which gives us, little hint of what is my passion, profession, occasion, and mission. This also helped me a lot. Yeah. Next slide, sir. And that's where we say the body is the base, the emotions are piled up, the mind determines it, and the spirit or the bliss body is what will enjoy. Only when your body, your emotion, and your mind are in equilibrium, you can reach out to that spirit body. That's the reason I said, sustain that bliss body, you have to work upon on most of your aspects and a constant. And when you are in right equilibrium with all these three, you will reach to that. Yeah, thank you, sir. That's his last slide. Thank you. Last slide. Yeah.
Thank you so
Thank you.
much.
Yeah.
Yeah. Thank you. This
So
is
I think
again,
a few more. Yeah. Thank you, sir.
Srinivas, Doctor, thank you so much for the great presentation. And I will say this is a very useful topic, and nowadays we all much need it, I think. So your friends, you all agree with me. So there's a lot, I think, maybe we can have another session in a detailed where we can talk about more meditation, and we also talked about different specifics of the genetics and all that. Really appreciate it. Thank you. It's a very valuable presentation. Thanks for taking time today to help us with this journey. Thank you. Thanks,
We'll take
Doctor.
one question, or anyone has any questions?
Yeah, please.
Yeah.
Yes, sir.
Yeah.
Anyone?
Yeah, I will ask one thing. So a lot of these genetic things you mentioned, I think I don't want to go in details, but how much I think we can change with lifestyle or with good habits? Because a lot of times, a lot of people getting early diabetes, and one excuse always says because of genetics. My mom has, my dad is. So what is your experience on that as a doctor, So as a general man can say anything because a lot of information out there in the Google people can read, but with your experience, what do you think?
Yeah.
Is that something can be taken care of, with good habits? That's one question I have. Thank you.
Yes, sir. Yeah. I would rather say, I will not go into statistics because the present statistics may differ from so many variations to area, like this way. But if I have to just even make it in a very simple way, 2% of our diseases belong to genetics, purely inherited one. Like if I say Down syndrome, wherein the gene
Yes.
itself is defective.
Correct.
But in diabetes, it isn't, okay? It is a lifestyle disorder. That means it is coming from my environment. I have been programmed like that. So when I say my father had diabetes, I have diabetes. That itself is a wrong input I'm giving it to my body. I'm creating my environment, which is wrong, and putting my input to my body. If had that been, then isn't it all the grandparents, if they would have been having all the diabetes, all their children should have been at the same time, same year. Why is that different then? Or I would rather say even their children. No, it is not like that. It doesn't work like that. All lifestyle disorders are nothing to do with genetics.
Right.
Okay.
No,
And the second part, I would really say, you somewhere said that we read from Google. That's where one thing, even now, I want to really wish to convey is that if you're reading anything which is relating to health, anything, you should always know from what source you're reading. Even medical, as a medical, person, if I have to read, I will just read it from, source which is PubMed papers, your experiments, if you're reading from, you cannot stick it from any source. The source may be not the genuine one, may not be a genuine study which has been conducted and out to put it there. You should be
Agree.
very careful when you're reading the matter relating to health. It's probably moving into, if at all you want to more read and details to it, it should be from PubMed or Medline source. Yeah. Thank you, sir.
Yeah, thank you. Thank you for the great insights. Thank you again. That's all I have. Yeah. Anybody else?
Thank you again, doctor. Thank you for your time. I
Thank
know you're in a difficult spot in a remote location, had some early challenges, but you're still able to make it.
Yeah.
Really appreciate all
Yeah.
the things you've done.
Yeah.
Thank you, sir. Thank you for this great opportunity. However, I could not do complete justice in the initial aspect. Okay, yeah. Thank you.
Thanks.
Thank you.
Yeah, no worries.
Thank you.
Thank you.
Really
Thank you,
valuable.
everyone. Thanks.
Yep.
Bye.
Thanks.
Thank you.
Thank you, everyone. Bye.
Bye.
Bye.